Neoplasms of the testis constitute a morphologically and clinically diverse group of tumors, of which more than 95% are germ cell tumors, GCTS. GCTS are broadly categorized as seminoma and non-seminoma germ cell tumor, NSGCT, because of differences in natural history and treatment. GCT is a relatively rare malignancy, accounting for 1% to 2% of cancers among men in the United States. Approximately 95% of GCTS arise in the testis, and 5% are extragonadal in origin. In the United States, testis cancer is the most common malignancy among men 20 to 40 years old and the second most common cancer after leukemia among adolescent boys and young men 15 to 19 years old. Testis tumors have 3 age peaks: infancy, age 30 to 34 years, and approximately age 60. The incidence of bilateral GCT is approximately 2.5%, 0.6% risk of synchronous, and 1.9% risk of metachronous contralateral tumors, Fossa et al., 2005. The incidence of testis cancer varies significantly according to geographic region. Rates are highest in Scandinavia, Western Europe, and Australia-New Zealand, intermediate in the United States and United Kingdom, and lowest in Africa and Asia, Vail et al., 2000. Incidence of testis cancer in the United States in non-Hispanic whites is 5 times higher than the incidence in blacks, 4 times higher than the incidence in Asians, and 78% higher than in Hispanics. The incidence of GCT appears to be increasing worldwide. A stage migration of GCT has been observed in several countries, partly secondary to increased awareness and earlier diagnosis. There are 4 well-established risk factors for testis cancer: cryptorchidism, family history of testis cancer, a personal history of testis cancer, and intratubular germ cell neoplasia. Cryptorchidism are 4 to 6 times more likely to have cancer diagnosed in the affected gonad, but the relative risk is less to 2 to 3 times more likely if orchidopexy is performed. A meta-analysis of cryptorchidism studies reported that the contralateral descended testis is also at slightly increased risk. A first-degree relative with testis cancer have a substantially increased risk of testis cancer, and the median age at diagnosis in these men is 2 to 3 years younger than in the general population. A man's relative risk for testis cancer is 8 to 12 with an affected brother compared with 2 to 4 in men with an affected father. History of testis cancer have a 12-fold increased risk of developing GCT in the contralateral testis, but the 15-year cumulative incidence is only 2%. Most GCTS arise from a precursor lesion, ICCN. ICCN is present in adjacent testicular parenchyma in 80% to 90% of cases of invasive GCT and is associated with a 50% risk of GCT within 5 years and 70% within 7 years.